I'm Sarah Radke. I'm an oncology certified nurse at the Cancer Center of the Carolinas. I have been an oncology nurse for the past 20 years and have worked inpatient and outpatient. I give chemotherapy, and so I see firsthand what it does before, during, and after its use. Chemotherapy causes a problem with the appetite. It can cause nausea and it can cause pain, as well as the disease process of cancer also can affect the appetite. When the appetite is affected, the patient becomes where they lose weight and they become emaciated. Their muscle tone is often lost, and their body fat is also lost, and many times the lab values of such as protein is also affected. Medical marijuana can be used to increase that appetite. It can be used by the physicians to help with that problem. Back in my inpatient days, which was about 18 or 19 years ago, we used a lot more of the medical marijuana called Marinol to help increase the appetite. It was given to the patient at a dose in which it was tolerable but got the desired side effects such as increase in appetite or nausea. Marinol also helped with nausea in a lot of the issues if they were having it, since the appetite also could be affected or was affected by the nausea. I have also seen it used for the HIV patients with AIDS. These patients are affected by nausea, appetite issues, and pain due to their AIDS crisis or the type of AIDS-related issues they are having. Pain is also affected because of the muscle tone and the body fat loss, which causes the emaciation, almost concentration camp-like, skinny, very skinny patients, which have issues due to sitting or laying due to the bone being very brittle and worn from sitting or laying. Marinol is not used as much today in oncology due to the fact that it has been replaced with a drug called Meagase. Since today more chemos are outpatient, these patients are trying to do more in the setting of having jobs or trying to function and whatnot. So the Marinol is not used because it a lot of times makes the patients unable to tolerate their activities. The physician I work for today states she doesn't use Marinol since a lot of times the patients complained of them making them feel stoned, which would not allow them to function in a setting such as work or at home where they need to take care of children or something in that sense. It also I have one story where I had a patient who used marijuana to help with his nausea. I believe he grew it himself. Though it is illegal, he used it to better his quality of life and to help with his nausea. His chemotherapy also caused him some numbness and tingling, in which a lot of times he states the marijuana also helped with that, according to him. My Marinol experience is very limited in my profession, but I'm sure in some areas of the country it may be used more than others. But today in our practice we do not use medical marijuana.